Over the past 3 years, we have had an interesting outcome in terms of raising awareness and talking to people at the level in which they can understand it from both an educational standpoint, clinical standpoint, but scientific standpoint.
We started realizing that we had to go out to the people. If you don't know you have a health problem, you're not going to seek out care. If you think your leg pain is due to arthritis, you're not going to seek out a second opinion or more treatment. So Dr. Fakorede realized that if you go to the churches, you can get people. Everybody goes to church. And we live in the Bible Belt, and that is the focal point, that is the drawing point for everybody.
Good morning. Good morning. Please stand and help me welcome our newest ambassador, health ambassador of the Mississippi Delta, Dr. Fakorede.
Good morning, family. Good morning, everybody. How y'all doing? Good. Thank you. Just want to start off by thanking everyone for bracing the elements of the weather today to come out to listen to this important message. I've decided to target faith-based organizations because in a faith-based setting, majority of all stakeholders when it comes to it being a provider, it being a family member, it being a politician, or a community activist, all show up in the same setting at the same time, and they can understand what the risk factors are, what the treatment should be, when to seek a second opinion if you're told about an amputation, and who the best physicians or providers that will be able to treat the conditions. Mississippi Delta residents have the highest rate of high blood pressure in the country. If we cut that down, meaning if we were to drop our blood pressure by 10 points, if I go from 140 to 130, you are 30 to 50% drop in terms of your risk of dying within the next 3 to 5 years. That's powerful, y'all. And most of these can be done without medications.
The idea that you have to wait for a patient to come to you is an old-fashioned way, or a way that's not going to work here in the Mississippi Delta. So we've made it our passion to try to get out at least once or twice a month out into the community and bring the word out.
So I've already talked about, things that we can do. That's why we're here today. We have Bard who's here to help patients look at the circulation down. Anyone who wants to get screened for it, you're more than welcome. Because screening is the preventative way to pick up this disease state early so that you do not end up with being a statistic or someone who's amputated.
It was interesting, a lot of the people that did come to get screened, these are people that are more proactive with their health. So some of those were negative, but as we discussed it with them, a lot of them would say, well, my mother had an amputation, my father had an amputation, my brother is having this problem. And Dr. Fakorede's coined the term being a community navigator, that it's going to take all of these people going out into the community and getting their word out. And so Mississippi serves as the epicenter for this, and we've been able to reduce amputation rates by 88% by multiple pronged approaches. One being raising awareness by going out to faith-based organizations, and generating the trust of both the providers and the patients. And lastly, just by treating everyone else as a family member.